There's more people joining, so we'll probably just go ahead and get started, and folks can keep joining as we go. So my name is Terry Lee Kelford. I'm the co-chair of the National Alliance to End Rural Remote Homelessness. My co-chair in crime was actually going to host this webinar today for us, but he had a last-minute work commitment he had to jump off on. So bear with me if I stumble through this, my apologies. So again, National Alliance to End Rural Remote Homelessness, we are offering a series of webinars. So if you're on our membership list, you'll get a notification for any upcoming webinars, but we're really excited about this one. One of the messages we've gotten loud and clear while doing this work on a national level has been that research and data has been really lacking around understanding what homelessness looks like for rural and remote communities. And so we're really excited to have Dr. Rebecca Schiff with us today. Michelle, if you want to just switch to the next slide, we have a bit of an agenda. We're going to just start with Rebecca. She's going to give about a 30-minute presentation. And then we actually have a little bit of a poll. So there's 4 questions we're going to ask, and we'll get you guys to respond to that. And Michelle Billick from the Canadian Alliance to End Homelessness, she's on as well with us. Thank goodness for her, because she helps provide all the support to these webinars. So it is being recorded, and we will be posting the recording on the website for the National Alliance to End Rural Remote Homelessness, so you can find it there afterwards if you want to refer back to it, or if someone has missed it, or if you want to share it. Once the poll is done though, so Rebecca's going to give a 30-minute presentation, we'll do a poll, and then we'll open it up to question and answers. So if you want to just type your questions into the chat box, we'll read them out to Rebecca if that's who they're for, and then we'll just wrap up. So we're going to try to get all this done in an hour. So I will stop talking, and I'll introduce you to Rebecca. So I've been really excited to connect with Rebecca on several occasions now about research. We set up a little research committee, thanks to Rebecca, really, of researchers from across Canada back in January. And so as researchers go, they're quite busy with their research projects. So we find it's kind of hit and miss in terms of meeting, but it's been great to pull people together from across the country and to be more aware of what the work that's happening. And I've noticed as well, just as the co-chair for the National Alliance, that more people are starting to reach out to us to ask how can we include questions about rural remote homelessness in our research projects. So that's really good. So Rebecca is an associate professor in health sciences at Lakehead University. Rebecca has been an active researcher and advocate on homelessness issues for over a decade, including work with the Calgary Homeless Foundation and Housing and Homelessness Committees in Regina, Happy Valley, Goose Bay, and Thunder Bay. She has focused particularly on homelessness and housing in rural, remote, and northern communities. Rebecca has published extensively on homelessness, including the 2016 book, Homelessness in the Context of H1N1, as well as over 70 other edited books, government reports, book chapters, peer-reviewed journal articles, etc. So welcome, Rebecca, and we're going to pass it over to you.
Thanks so much, Terry Lee, for the introduction, and I'm really honored to be here today, and pleased to have a chance to present about some of the work that I've been doing and some of the plans that we have over the next year as well. And I should also maybe add to my bio as well that I am a rural dweller. I've been a rural dweller for many years, and I've lived in rural Alberta, rural Saskatchewan, in Happy Valley, Goose Bay, in Labrador, and now in rural Ontario. I live in an unorganized township outside of Thunder Bay, so very, very rural location as well. And I'm very passionate about rural living and the needs and livelihoods in rural environments. So yeah, just going on to the next slide, I guess. I think Michelle is maybe changing slides. Yeah, okay. Yeah, so I wanted to actually put acknowledgements first, and before I get into some of the acknowledgements that are listed here, I do want to acknowledge that I'm zooming in today from the lands of the Robinson Superior Treaty area, and also acknowledge it in Ontario. It is Treaty Recognition Week, and I think that comes first and foremost and really important to consider when we're talking about rural and remote homelessness. I also wanted to say I got a really lovely email from someone this morning who was telling me about some of the what's happening in their rural region, and how significant housing insecurity and homelessness issues are there. And I think I just want to acknowledge as well all of the people who are living in precarious housing situations or experiencing homelessness in rural and remote communities, who have participated, taken their time to share stories and participate in research and helping to bring more awareness to these issues, so that we can try and obviously bring an end to homelessness across Canada and homelessness in rural and remote Canada. So I have some specific acknowledgements here as well. And I think it's important for me to put these up front because so many of these individuals and organizations have played a really important role in the work that we've been doing and that I've been doing for the past many years. So some of the individuals I want to acknowledge who were involved in our previous research around pandemics and homelessness are Dr. Christy Buccieri, who's at Trent University, Dr. Stephen Gates, who's at York University, Dr. Bernie Pauly at University of Victoria, Dr. Jeanette Wagemaker Schiff at University of Calgary, and some of our more recent partners, Dr. Kirill Kalpi at Laurentian, Dr. Milan Riva at McGill University, and Dr. Julia Christensen at Memorial University, and many others. And I also want to acknowledge a number of organizations. So the Homeless Hub that has been really key in supporting some of the work that I'll be talking about today. Also the Canadian Institutes of Health Research, or CIHR, the Social Sciences and Humanities Research Council, or SSHRC, as they're known, that have provided funding for this research. Obviously the National Alliance to End Rural and Remote Homelessness, that's a really great new partner in this work. And also another partnership that I'm involved with, and I'll talk more at the end, at Home in the North, which has also supported some of the work that I'll be talking about. Next slide, please. So today, I guess we're talking about homelessness and pandemics, and I'm going to start a little ways back, going back to our last pandemic, H1N1. So 12 years ago was when we experienced that, and at the time there was some funding that was received from the Canadian Institutes of Health Research, and that project was led by Dr. Gates at York University, but it also had many other researchers involved, some of whom I mentioned earlier. And it included research sites in Toronto, in Regina, in Calgary, and Vancouver. Those are the main research sites that we were able to use that data and then release our findings about the data that we collected there. There were some other sites in Quebec, but we were not able to bring out the findings from those other research sites, unfortunately. In that research, or I guess where that research came from, was a recognition that during H1N1 and prior to H1N1, homeless people were not considered in the at-risk population or in the vulnerable population of people who would be most vulnerable during pandemics. And so we thought this was a little bit strange for several reasons. One is because during H1N1, as we now have during COVID as well, a lot of the public health directives are impossible to follow if you don't have a home. So things like, if you feel sick, stay home, or isolate yourself, or wash your hands frequently, and other public health directives that if you're homeless or if you're in an insecure housing situation, just become really difficult to follow. So we thought, well, that's not good. Maybe homeless people are a vulnerable population. And we also saw that there wasn't any research that had been done anywhere, not even in Canada. Nowhere else could we find any research about homelessness and pandemics. Next slide, please. So what we were interested in then was learning a little bit more about the situation and what we could do to improve our ability to respond to pandemics within the homeless sector, and for homeless people as well. And so we wanted to know about the experiences of people who were experiencing homelessness during the H1N1 pandemic. We wanted to know what service providers had experienced, their perspectives on H1N1, the challenges that they had encountered, and also talk to policymakers and planners at municipal levels. So we used interviews and surveys. So we conducted interviews and surveys with homeless individuals. We also interviewed service providers and policymakers or pandemic planners at the municipal level. And we had 3 research questions that we were trying to answer. So the first question was, what risks does a potential influenza pandemic pose to people who are homeless in Canada? The next question was, how do the design and structure of emergency homelessness services impact the spread of infectious diseases? So basically, does our homeless response system impact in positive or negative ways how infectious diseases are spread? And the final was, how adequately prepared was the homeless sector in being prepared for a pandemic situation. Next slide. So what we learned from the study after all of the data we collected and we talked to many people was, one, homeless persons are more at risk during a pandemic. So they have greater vulnerability. This is partly due to just poor health outcomes in general for people who are in poor housing situations. We know that housing is a determinant of health. So housing, if you have secure, safe, affordable, adequate housing, it has a great influence over your health status in general. So in people who have poor health status will be more at risk to contracting or to more serious outcomes from infectious diseases like H1N1, like COVID, like other infectious diseases, tuberculosis, even the common cold or other types of influenza. And so because of this, homeless people should be considered a priority vulnerable population during pandemics. And so we should be directing resources towards making sure that homeless people can be safe during pandemic situations. So this is what we learned during H1N1. We also found that our current response system, our homelessness response system, would be more strained in the event of a more serious pandemic. And this is because our response system at the time, and I think we're shifting away from it now, but at the time was really focused on emergency response. And because it's focused on emergency response instead of getting people into long-term stable housing, or it was, there are a lot of challenges there around pandemic situations and making sure that people could be stably and safely housed. So the homelessness system in general was a problem during H1N1. Next slide, please. So, and some other things that we learned, going just back again, the previous slide. There we go. Oh, now we're too far. There we go. That's the one. Okay, service providers and planners also said that they needed more support for planning. So service providers said at their local level in their organization, they did not have support to create pandemic plans. So homeless shelter said, we don't have pandemic plans, or we don't have support to create pandemic plans, or especially smaller organizations, but even some larger organizations as well. And also at the systems level, where service providers could be brought together across a municipal environment, across the city or across a region to plan for pandemics and how they would respond together. One really interesting sort of anecdote that I heard in Regina, I was the site lead for this project in Regina. And so I was speaking with a lot of people in that city about this research and doing interviews there, was that one of the largest homeless shelters in Regina was actually the evacuation site for City Hall. So if City Hall had an emergency that could be related to a pandemic or could be related to another emergency, that this homeless shelter is where everyone from City Hall would evacuate to. And it just really didn't make sense to that service provider that people would be evacuating to their location when they're already under-resourced in terms of their emergency response system. So another thing we learned, and I think some of this is very pertinent to our current situation with COVID, was that the service providers needed better access to supplies. So we know that now with COVID, there's been a real need for access to PPE supplies, cleaning and disinfecting supplies as well. And that's been much better, I think, in COVID than it was in H1N1. And maybe it's because we had sort of awareness raised during H1N1 that this was a challenge. But another thing that was a consideration for the people we talked to during H1N1 was vaccination clinics. So in some places, the vaccination clinics were in places that weren't at all accessible to where many of the homeless shelters were. And so because transportation was limited and because the vaccination clinics were quite distant, it was really difficult for the people that they were serving to access those clinics. So vaccination clinics needs to be taken into account as well. And I think this is especially true in cities, like there are some places where a lot of services that homeless individuals would access were located in places that weren't primarily residential areas. They weren't high residential areas. And so the vaccination clinics, they were stationing them in high residential areas so that, you know, people could easily access them from their homes. But that didn't make it easy for people who were living and staying in homeless shelters to access them. So the other thing that we learned was that we really needed different infrastructure that would be more adequate for sheltering options during a pandemic. So shelters just didn't have facilities to quarantine people or to help people isolate if they were symptomatic. And that was a big challenge as well. Next slide, please. So we put a lot of this into a book, and the book it details pandemic response in 4 cities. So the 4 cities that I mentioned earlier: Toronto, Vancouver, Calgary, and Regina. There's a chapter on each of those. There's also a chapter on a national health survey of homeless people, and this is the first nationwide survey that was conducted on homeless people in Canada, and that might have some useful or interesting information for people as well. We also had some chapters that were more broadly on the sort of legal implications, social justice rationale, and other arguments and recommendations for why homeless individuals need to be considered a priority during pandemics, and not just pandemics, but in general, that we needed to end homelessness. And that book is actually free online. You can get it at the Homeless Hub, and I have the link here in the presentation. And I think this presentation is being recorded and will be online, so you can certainly access it later. You can also get a print book. I think there's a charge for that, but the free ebook is online. So what we learned, or maybe what other people learned, such as the federal government and provincial and municipal governments, was that it was really important to consider homeless people as a vulnerable population during pandemics. And this was reflected in Health Canada's Canadian Pandemic Influenza Preparedness Planning Guidance for the Health Sector document. And so they recognize the research that we had done and that was presented in this book, and they do identify that there are particular needs in the homeless sector around planning for a pandemic. And I think that as a result of this, and a lot of the fantastic work that other organizations like Canadian Alliance to End Homelessness and the Homeless Hub and many others have been advocating for, is that we did see much more resources put towards supporting the sector and supporting homeless individuals during the current COVID pandemic. And it was immediate. I think very soon in March or early April that the federal government announced additional supports through Reaching Home for homelessness service providers, and a number of other initiatives that were implemented back in the spring, and also more recently in August and September, new announcements of funding investments for creating more affordable housing units in Canada, eviction prevention. Although I think the really challenging situation that we're facing right now is the eviction prevention supports that were removed in August, and some of the other things that provincial governments and municipal governments had done to try and help prevent people from becoming homeless that are now not available. So we can go to the next slide. So I guess, we learned a lot from H1N1, but we had still a bunch of questions, and especially in the context of COVID. So there are some questions around, you know, all of these resources, the hundreds of millions of dollars that has been poured into the homeless sector during COVID. I've heard some people ask, where were these resources pre-pandemic? And, you know, this idea that we basically, in a lot of communities, I don't know if it's in every community, but a lot of communities that I've spoken to, in a way, they've been able to end homelessness because they've had the funding to implement new programs to find a shelter for everyone, whether it's in a hotel or some other temporary shelter. Not ideal, but basically, you know, I've heard people put it in this way, you know, if Canada had the capacity to end homelessness with all this funding, why did it take a pandemic to make this happen? So it's sort of a critical take on what's going on right now. There's also the concern that there's going to be a drastic rise in homelessness as a result of COVID and the economic downturn. And a number of people who, you know, prior to March 2020 would not have been considered at all at risk of homelessness and are now very much facing that situation. And there are some other concerns about what's going to happen to all of these resources after the pandemic is over. And you know, because there are a lot of communities that have been able to implement new programs or do things that they just could not find the resources for before the pandemic. And so when that additional funding, COVID-related funding dries up, what's going to happen? Will support for these really important innovative programs, will that disappear as well? Next slide. So, yeah, that's the one. And other questions that sort of came out of this was what we're all here about. What about rural and remote communities? Because in fact, the book and the research that we did in 2009 and what we were able to publish on that didn't have any data from rural and remote communities, and it didn't really have that consideration of the unique needs of rural and remote service providers. And so that was a really big concern, and that sort of came up for us during COVID, because it was sort of since that time, at least for myself, that I started doing research on homelessness in rural and remote communities. I hadn't thought of it at the time, and I think much of our research team hadn't thought of it. And since then, there's been a really growing recognition and more research coming out on homelessness in rural and remote communities. And you know, a growing recognition that it's really a significant concern. I think, you know, there's been more professional attention. So we have really important initiatives like the National Alliance to End Rural and Remote Homelessness and other professional initiatives around rural and remote homelessness, and more academic attention. So more research being conducted on the topic. You know, we also know that migration is a significant issue, in that there are a lot of people who migrate from rural communities to urban communities, who may become homeless when they're living in a rural environment and go to an urban environment to access resources. And it also happens the other way around. So we did a study in 2017 for the Ministry of Municipal Affairs and Housing in Ontario. And I see there's a little typo on the slide, but it's called Homelessness in Rural and Northern Ontario. And you can access the report on that study at that link. I created a small link for it because it's actually really long, and that'll take you directly to the PDF of that report. But in that study, we found that there were actually a lot of people who were going from urban environments to rural environments as well. So they might be from a rural area, they go to an urban place, they say, well, it's not so great here in the city, and then go back to a rural place and so on. So it's not so straightforward or linear as just people going from rural areas to urban areas. And an increasing concern, and I've heard this from service providers in cities that have framed this as their homeless problem is coming from rural areas. So it's like rural areas are kind of, their problems are being exported to urban environments, which I'm not a fan of that way of framing things. But I see that, at least to say that there's more recognition in cities that that homelessness isn't just a problem in urban environments. And also homelessness rates. This is something I've been sort of doing off the side of my desk for the past for the past little while when I get a chance is just to run some data on who's homelessness where and what are the rates of homelessness in rural Canada. And as an example, the Grand Prairie, which is not, it's a smaller city, but it's certainly in a northern and more remote area. It has, if you take the number of people counted at their point in time count and compare that against their population, their rate of homelessness is 0.36% of the population. And you can compare that to Calgary, which also did a point in time count. It's from the same year. So the same census data and same year for the point in time count data. Calgary only had 0.22% homelessness. And then if you take other examples, so Lanark County that shows a homelessness rate of 0.4% of the population in its period prevalence count. And there are other examples of this. So I think all of this is to say that there might be a misconception that there just aren't as many homeless people in rural areas as there are in urban areas, but I'm not entirely convinced that that's true. I don't think we've gone into the data enough yet to really say that, and that homelessness is probably at least as significant a concern in rural areas as it is in urban areas. The other challenge around this, and it's very much related, is that rural and remote service providers have more limited access to federal homelessness funding. So there's less funding for rural and remote communities, much less than there is for urban areas. And it's disproportionate. So if you take the percentage of population that lives in rural Canada and compare that to the amount of homelessness funding that's received, it's out of proportion. So so there should be more proportionate funding to rural communities. The other challenge is that urban areas are designated communities, and they receive a designated pot of funding every year. They know they can count on getting a certain amount of funding through the Reaching Home National Housing Strategy every year, whereas most rural communities and remote communities have to compete for one big pot of rural and remote funding. So the other issue around that as well is the smaller the community, the more difficult it is to find the resources to actually apply for that funding. So if you're, a community of 500 people, it's really difficult to compete against a community that has maybe 10,000 people. Maybe it has a few more resources to apply for funding. Or if you're a community of 10,000, it might be difficult to compete against, in other competitions against communities that are really large. So homeless shelters in Toronto that have 400 staff persons and might have people that are dedicated to just writing funding applications, and you're in a community where you don't have that kind of resource, those kinds of resources at all. So there are a lot of challenges around funding. And the same thing has been true during COVID. So there's been a whole lot of money that's gone into supporting homeless individuals and homeless service providers during COVID. But again, it's the amount of funding received in rural and remote Canada has been disproportionate to what's received in urban Canada. And it's also been a competitive process. Next slide, please. So there are other sorts of questions that are specific to rural and remote communities in the context of COVID that we didn't answer during our H1N1 research. So first of all, there's a concern that rural and remote communities also often have less infrastructure or resources. There's just not as many shelters or service providers in communities. About the migration, I mentioned that earlier. So we know that migration is significant between rural and urban communities in terms of people moving back and forth and being homeless or housing insecure and moving back and forth between different rural and urban locations. But also, how does this intersect with pandemic-related needs and concerns? So this migration, especially when people are told to kind of stay at home, stay in one place, how is that affected during a pandemic? And then finally, what are the unique needs or considerations for rural and remote service providers during pandemics? Because we didn't find that out during our H1N1 research either. Next slide. So we've got all of these questions. Sorry, there we go. Okay, so we realized that there was this big gap, and we needed to do more to support rural and remote communities during COVID and just in general in terms of homelessness response and ending homelessness. So we applied for some funding. The Social Science and Humanities Research Council of Canada had special funding for COVID-19 related research. I think we need to go forward again. Yeah, there we go. They had special COVID-19 funding, and so we applied for some funding to try and answer these questions. And in our research application, we asked 4 questions. So those questions were, what is the experience of rural and remote service providers, homelessness service providers during COVID-19? Has the COVID-19 pandemic changed migration of homeless people between rural and urban areas, and also affected sort of the ability of rural service providers to access resources that might have previously been provided by urban counterparts, and so on. The third is, what are the capacity and needs of rural and remote communities to respond to homeless persons during the pandemic? And also finally, we want to know about new innovations in service delivery that were launched to rapidly house or support people during the first wave of the pandemic, and even now, you know, as we're going through a second wave. So we know that a lot of new stuff has happened and some really important innovations and new programs in service delivery, and we'd like to know about that as well. And hopefully with an, you know, focus on trying to get more support to keep these innovations going, to keep people housed, you know, safely and adequately after the pandemic. Next slide. So how we're going to answer these questions, we're going to conduct a survey. I said surveys, it's really just one survey. It's an online survey for service providers about their experiences during the pandemic. And we're using a combination of some surveys that we've used previously, including a bit of a survey that the Canadian Alliance to End Homelessness had done, but adapting that to rural context, and also using a survey that we did in our rural Ontario study in 2016. But it's going to be a national survey, so we'd like to get responses, you know, from everywhere across Canada and the territories in all the rural and remote parts of the provinces as well, if we can. And that survey, we're going to distribute it through emails, through newsletters, and through social media distribution through the National Alliance, and also through the At Home in the North project. And we're planning to launch that, I'm hoping in January. So we're just sort of finalizing that survey, and we have to get ethics approval to conduct that research. And so hopefully we'll be able to have that all in place and launch the survey in January. Next slide. Oh, we're missing a slide. Oh, back again. One more slide back. There we go. We're also doing interviews. So we would like to conduct Zoom interviews, or if needed, telephone, because we know the internet is sometimes terrible in rural and remote Canada. But with service providers, and we'd like to know perspectives on pandemic planning and what their needs are, what their experiences have been during COVID, innovations that they know of, and also a little bit about migration as well. And again, we hope to include people from across the country. We're using some of the similar questions that we used in our H1N1 guide. And so we can sort of compare some of what we learned in H1N1 and what urban providers told us with what we hear in these interviews as well. So that will be really useful to have that point of comparison. And people will be able to opt in to completing that interview through the survey. So there will be an option at the end of that online survey, if you want to be involved in the interview, that you can provide your contact information to be contacted for an interview invitation. And we'll also send out through email. We'll probably do the same process, where it will go out through maybe social media and newsletters and emails to invite people if they want to be involved in an interview to contact us. And hopefully we'll be able to start those interviews in February. Okay, next slide. Okay, so what are we going to do with this information? We are going to have some infographics, hopefully like brief reports that will include some visual depictions of what we learned, and we'll have these available on the National Alliance website and also distributed through social media. So National Alliance social media, also At Home in the North, and my own social media accounts. So people can access the report there, but also through direct contact either with the Alliance or with myself. And we also hope that we'll be able to have more public presentations, webinars, certainly conference presentations on what we've learned from after we've collected all the data and can report on it. We also want to create some sort of policy brief documents that might be useful for policy and decision makers. And we'll also create some articles for academic and professional journals. And we actually wrote an article, it was a commentary piece that was published in the Canadian Journal of Public Health in September. And that's basically an argument for policymakers to pay more attention to rural and remote homelessness and the needs of rural and remote communities during pandemics. That's also a free article. It's open access online at the link that's just in the presentation as well. Next slide. And yeah, I think that was, oh no, there's one more slide before this one. I'll just quickly, At Home in the North, I'll let people know about this. So out of Reaching Home, so the national, oh no, there's What's Next, How to Get Involved. So just stay tuned to the National Alliance on Rural and Remote Homelessness, to their website, social media, so Twitter and other social media, to announcements. And you can also get in touch with me. So my email address is rschiff@lakeheadu.ca, and you can also find me on Twitter at Rebecca Schiff. And that final slide, or not the final, next to final slide is about At Home in the North. So you can switch over to that one. And that's about a project that's funded through Reaching Home, through a partnership between SHRC and Canada Mortgage and Housing Corporation. And that's one of 5 nodes of the newly formed Collaborative Housing Research Network. And it's focused on Northern Canada. We're doing a lot of research around homelessness in northern communities, including rural and remote northern communities. And we also are doing some research on COVID-19 in the north. So we have projects with Anishinaabe Nation in Northern Ontario, out of Thompson, Manitoba, and others, where we're looking into intersections between pandemics and homelessness in those communities. And you can find more information on our website at homeinthenorth.org or on Twitter handle at Home North. And then the last slide, I just have some additional resources, the book that I mentioned earlier, but also some other articles and reports that might be interesting, links to websites for the Canadian Alliance to End Homelessness resources on COVID-19, the Homeless Hub resources, CHRA resources, and others. And that's it for my presentation.
Thanks, Rebecca. That was great. You can tell you're a professor because you have no problems presenting in these contexts. You do this a lot, obviously. That was great information. Thank you very much. We're excited, obviously, as you know, from the National Alliance about this research project. So, and as you mentioned, we certainly hope to be a source of just context and content and a contact to you as well in this project. So if people follow along and stay tuned, we're hoping to distribute the surveys and help you out in any way we possibly can as a partner in that project. So thank you for including us, and thank you for including the information that we're going to build across Canada around rural remote homelessness. So I think it's important work, which is great. So thank you for that. We appreciate it. So Michelle, I think, is going to take over and do a quick poll. We have some predetermined questions we'd wanted to ask. And then if anybody has any questions, though, please type them in the chat box for Rebecca, and we will pass them along to her and address them right after the poll. If not, I'll get to ask questions, and that's fine for me.
That's great. Thank you so much, Dr. Schiff and Tara Lee, for having me. And I just want to apologize, but this is what happens when you have a wireless mouse. It sort of goes crazy and just wants to move forward 6 slides in a row. So thank you for bearing with me, everyone, and being part of this presentation. I'm going to be launching a poll right now. There's 4 questions. So it's in progress right now. You should be seeing the polling questions. The first one is, do you think that rural and remote communities should get proportional funding to address housing and homelessness needs similar to urban centers? So you can put in yes, no, or not sure. Okay. The second question, are you concerned that COVID-19 will cause an increase in homelessness and housing insecurity in your community? Yes, no, not sure. The third question is, have you seen an increase in homelessness and housing insecurity in your community as a result of COVID-19? Yes, no, or not sure. Okay. The fourth question is, do you think that the federal and provincial governments are doing enough to address homelessness and housing insecurity during COVID-19? Again, yes, no, or not sure. So I'll give you about 10 more seconds to complete the poll. We have about 69% of the participants that have voted. So if you haven't voted yet, go right ahead. All right, okay, I'll end the poll. All right, so the polling is now closed, and I will share the results with you. Okay, so 94% of you responded that yes, you do think that rural and remote communities should get proportional funding to address housing and homelessness needs, as urban centers do. In question 2, 94% of you said that you are concerned that COVID-19 will increase homelessness and housing insecurity in your community. And 67% of you said that you have seen an increase in homelessness and housing insecurity in your community as a result of COVID-19. And finally, and I know that most of you, oh, it's interesting. 72% said no, you do not think that the federal and provincial governments are doing enough to address homelessness and housing insecurity around COVID-19. Well, that's not much of a surprise, is it? Okay, well, thank you all for participating in the poll.
Thanks, Michelle. That was interesting, actually. I'm wondering if that 74% thinking that the federal government hasn't done enough. I mean, certainly I'm sure that's an urban phenomenon as well, but I'm curious to know if that's partially because of the way the funding's structured for rural communities, and why the perception in small communities is that there's not enough support. Clearly, I don't think there's enough funding, and I think the structure for providing funding is certainly quite different than urban centers, which affects small communities' ability to build sustainable programs, but something more to dig into. So thanks, Rebecca, for helping out with those questions too. Any thoughts, Rebecca, on those responses?
Yeah, no, it is really interesting, and nice to sort of hear from people about their responses to those questions as well. Yeah, and that some communities that there's a feeling that homelessness hasn't gone up, or that maybe it won't get worse as a result of the pandemic is really interesting as well. But certainly around the funding piece, or whether the governments are doing enough. And it's one of those things you love to dig into more and have more of a conversation. Well, more should we be doing? And I think that's more around just ending homelessness in general instead of this continued focus on an emergency response.
Yeah, and we didn't talk a lot today about hidden homelessness, but certainly what homelessness looks like in rural communities is quite different too, right? And that's certainly in my work in Lanark County, that's an obstacle all the time, is trying to convince people that homelessness exists when, first of all, people don't want to disclose themselves as homeless or identify themselves as homeless because of stigma, but also because they're just not seen outside. They're in the forest, or they're underneath a bridge, or they're in an abandoned building. So yeah, so I think any more information we can get in terms of like the numbers you're crunching in your spare time is helpful as well. So yeah, so we do have a question and a comment. Kaylee has said, to clarify, as a Manitoban, I think the federal government is doing a decent job of providing funding, but the provincial government is doing a dismal job. So do you have any thoughts on that, Rebecca?
The federal government's doing a decent job, the provincial government is doing a dismal job. I can't remember what the situation was in Manitoba around eviction prevention. I know that it differed from province to province. So in Ontario, we had a moratorium on evictions for the first several months of the pandemic, and then that was lifted, which was absolutely terrible because there were still, you know, millions of people in Canada who were either completely without work as a result of the pandemic, or had much less work than what they had before the pandemic. So it wasn't at all, it's just a really challenging situation. But, you know, I think as well, I do agree, the federal government has certainly done a lot more during COVID-19 than what they did during H1N1. And even H1N1 was not nearly as serious a pandemic. We know that, but there was still absolutely nothing that was done at all for homeless organizations at the federal level. So I'm happy that something is being done at the federal level. And yes, also provincial governments, there are some that are certainly not doing as great a job as they could be in terms of their responsibilities for housing and homelessness.
Yeah, and I would just add.
I see Michelle said Manitoba.
Oh, sorry.
Yeah, I think.
What did Michelle?
I just wanted to add that. Yeah, that's still, you know, Rebecca, you talked about the eviction moratorium, but now that that has ended, we're seeing in quite a few provinces clawbacks on CERB for recipients of social assistance. So I think that that will be a problem in the up and coming months, you know, when we're discussing prevention of homelessness.
Yeah, and I would just add, actually, Kaylee, what you're saying about Manitoba being, the province being different than the federal government. I think the other challenge, I think, when it comes to advocating, especially for the National Alliance to end rural homelessness, is that each province handles the funding differently. And so Ontario is the only province, for example, in Canada that has offloaded their housing portfolio to the municipalities. And so funding flows differently in Ontario than other provinces. So it's an interesting debate that we've had, or conversation we've had across the country, is how we help advocate for provincial funds, but also federal funds, and how that money flows and how it affects the various communities. So I agree that disconnect between provincial and federal funding is problematic for sure. So we also had a comment or question from Stephen, who said, to what extent are novel housing solutions, example, tiny homes, a viable solution to ending rural remote homelessness? Rebecca, what do you know about tiny homes?
You know, I know a little bit about tiny homes. Not a great deal. I think Terry Lee probably knows more than I do. And we have a really great researcher who's on our research team for the National Alliance, his name is Eric Weissman, and he's at University of New Brunswick, and he's really interested in tiny homes and passionate about them, and thinks that there could be a really great response to ending rural remote homelessness. So I'd encourage you to go and look him up and see what he has to say about tiny homes. But I certainly think that, you know, things like tiny homes and other solutions, like, we need to think outside the box in terms of ways that we can make more housing available for people, and not just like in a quick slap it together kind of way, like a real home that feels safe, that feels, you know, appropriate and comfortable for people as well. And tiny homes, if they're done well, maybe they are a really great solution in some communities. There's also the really big problem in remote communities in terms of just getting materials for construction and building. And I think there are some really great innovations that are happening in Northern Canada, in remote communities and First Nations, around milling their own lumber, doing lots of sort of social enterprise type programs to get homes built in their communities as well. So I think tiny homes, among a number of other innovative ways of getting housing built, are really important. And especially when we look at, you know, some of the traditional ways that we're thinking about building housing units, just the cost is so high that I don't know when we'd ever be able to get all of the units built that we need to build if we focus on these really traditional techniques with really that are really labor intensive and really high cost. So we need these other kinds of solutions. That's my thoughts. But Terry Lee, I don't know. I think you thought a lot about tiny homes as well.
Well, yeah, we stumbled across that issue just because we were building small units for youth homelessness in Leonard County. And so tiny homes kind of became the focus for us. We were going to have Algonquin College was actually going to build a unit every year for us, a small unit. So, but anyways, it kind of launched me into this world of tiny homes because it's now become a weekly discussion. Somebody's calling me, asking me about tiny homes. So, but you know, what I would say in short is that right now we have a national housing crisis and we need as many housing options on the table as possible. And what is astounding to me is that tiny homes are primarily illegal in many contexts when it comes to code and planning, municipal planning bylaws. So, and that just astounds me because I just think, again, we need every option we've got on the table. And I think if people choose a small home, why do they not have that choice in Canada? This whole bigger is better mantra when it comes to housing has actually caused all kinds of problems for folks in the sense that we've really ruled out these viable small options that people want. They're begging for, actually calling me up and saying, how do we get this done? We can't legally get our tiny home on the ground. So, so I just think that right now it just does not make sense to have this bigger is better mantra, that there's all kinds of gentle densification options that we have including in urban centers, actually, where we could be using these ideas like tiny homes. So, and I spoke to a woman actually in Moosonee, Northern Ontario, who actually shipped a tiny home on wheels up on a train and is now in the process of working with with Moosonee to get it legally on the ground with her and her partner. So, so there's really cool stories right across the country, actually, where people are advocating for and fighting for the access to for tiny homes. So, but I think I would only say this: the misconception is that you know, the only pushback I've heard is that there's resistance to tiny homes because we don't want to force people into small accommodations. And what I find interesting is that we can't force them into small accommodations because it's typically not legal. And it's actually people who are fighting for tiny homes that we need to look at it sort of from the reverse direction. It should be a matter of choice. People want to choose that, they should be allowed to. So Shannon, is there a portion of government money being provided to deal with homelessness directed towards people who will experience eviction due to lack of funds because of the economic downturn brought about by COVID-19? The Rapid Housing Initiative does not appear to be aware of the diversity of peoples who are in danger of becoming homeless. Yeah. Rebecca, do you have thoughts on that? Are you familiar with the Rapid Housing Initiative? The new announcement of $1 billion?
I mean, it's so new that I don't know the diversity of things that are being done. So, you know, we have a really great, I think, network or community of service providers who are working to end homelessness across Canada and have, you know, come up with really great innovative solutions in the past, and I think are aware of some of these challenges we're facing right now. So I wouldn't be surprised if there are people out there thinking about this issue, but I don't think that necessarily the federal government has thought of that, or other levels of government have thought of that, you know, the sort of diversity of new, you know, this new wave of homelessness, homelessness among the middle class, like that sort of thing. But it was interesting because I was on a cross-country checkup a couple of weeks ago on CBC radio, and we were talking about this issue about middle class, you know, this sort of, you know, wave of economic downturn that might affect, or that is very, you know, much affecting and will have greater impact on sort of quote unquote middle class Canadians, and talking about housing and homelessness and how we might see this sort of new range of people who I mentioned earlier in my presentation that are going to experience homelessness. But I don't think that there's been any resources specifically directed towards that yet. There was the eviction prevention, the eviction moratoriums. I think that was the closest thing we came to any kind of resources directed towards those people during the pandemic, and now there's just really nothing specifically. Yeah.
Yeah, and I think, you know, again, when you talk about rural remote homelessness, I think the problem is for small communities, if you don't have the infrastructure in place to handle a large sum of money being pumped into your community really quickly, it's really hard to organize on the spot. And so I find we hear across the country, there's a few concerns about some of the federal funding, is that small communities can't act fast enough to get the infrastructure in place to actually apply for those funds. And they also find that the application process is daunting. So there's a lot of, the application process can be quite extensive. And so if you're a small agency run by volunteers, it's hard to find the time to actually pull all together the criteria you need to meet the applications. Michelle could probably speak to this too, actually, as she's works with the Ontario Alliance to end homelessness.
Yeah, I was just going to say, like, you know, usually eviction prevention is something that unfortunately most communities and municipalities have to bear and deal with. And, you know, with all the supports that have been coming from our federal and provincial governments, there has not been any direct funding specifically for residential renters or small landlords at all. And yeah, there's a lot of conversations currently going on around the prevention piece, around the clawbacks, yeah, and how that may really impact our communities, that we might be seeing an increased number of individuals who will end up being homeless if they don't have like community rental banks, or the communities don't have some sort of fund around prevention.
I think that's one of the concerns too with some of the COVID funding that's happened across the country too, is it's very short term. It's all oriented around the year end, which is coming up March 31st. So it's fine to get a big chunk of money and to give it out, for example, for rent supplements like we do for our youth housing program for in Lander County. But come March 31st, we can't just say, sorry, folks, we no longer have rent supplements for you. And, you know, people have signed leases or they've depended on that money to actually get their housing to begin with. So then what are they supposed to do without the rent supplements? So that sustainable piece around some of this COVID funding, I think is an important conversation. I'd like to think that there's going to be more coming, but as it's rolled out, there's been this caveat of just remember it ends March 31st. You got to spend it before March 31st.
There are also the mortgage deferral options where people could defer their mortgages with their banks. And so that was an option that was available to small landlords. But part of the problem with that is that it would compound your interest. So all of your deferred payments would actually, you would continue to pay interest on them. And so your interest payment over the life of your mortgage would actually be larger as a result of your deferred payments. So that was a problem as well. But I see someone also noted that there is assistance through provincial SSRF to support households with rent mortgage arrears as part of eviction prevention. I'm not sure what province that might have been in. I'm not familiar with that program.
Oh, yeah, I'm not sure either, actually. I'd be curious to know. They can always contact us and let us know behind the scenes. The anonymous. Rebecca, I'm conscious of the time because I know you said you have to hop right off at 2 o'clock. So so I want to take the opportunity to say thank you. Thank you so much again. I'm going to say this a million times to you, so you're going to be tired of hearing it, but thank you for your commitment to, you know, focus on rural and remote and northern homelessness, because I think it's really important and a neglected issue. So thank you for filling that gap and stepping up and being a real champion for that. And we look forward to working with you on this project. So as you know, we'll be in lots of talks, and you can forward any information you have on the project as it rolls, including, I think, the survey again, right, is the next step. So that'll be rolling out.
Yeah, that's the next step.
Great.
Yeah.
And then if anybody's interested in
questions,
bye, Rebecca. If you need to pop off. Just to summarize quickly to wrap up, we do have a town hall booked with Adam Vaughn next Monday. So if you're interested in the Rapid Housing Initiative and how folks apply for that from a rural remote context, we have Adam coming on to answer some questions for us and to give a presentation. We also have a webinar we're planning right now, although we don't have the date announced yet, with FCM, the Federation of Canadian Municipalities, and CMHC to talk about their capital funding models as well. So stay tuned. And if you're not on our membership list, go to the National Alliance website at www.NAERRH and join our membership, because then you'll get access to those dates and times as they come up. So Michelle, thank you so much. You're a rock star. Thank you for helping out with all these webinars with us. So
it's my pleasure. My pleasure. This is great.
Behind the scenes, you don't get enough credit for all the work you do. So thank you very much. All right. Thanks everyone for participating. Thanks for the questions.
Yep, and also it will be, the recording of this webinar will be on the Rural Remote website, National Alliance to End Remote Homelessness website, as well as Dr. Schiff's slide deck. So that should be coming up in the next 24 hours.
Perfect. Thanks again, Rebecca.
Thank you, Dr. Schiff. Thank you, Tara Lee. Thanks everyone for joining us.